delighted that we're partnering with NHS England to offer support to those people who help others with digital health tools to understand and learn about the latest changes to the NHS app. And this follows on from a piece of work that we did a few months ago on accessing the NHS app. And one of our speakers, he's now disappeared off my screen somewhere, is here, Fran, who spoke as a patient about what it was like to be able to use the NHS app. And that's really important to us, and it was really well attended. So this follows on from there, because, you know, if you look at inequalities of health, we really need to make sure that those people who want to access digital health tools have the support. So all the community connectors and the work that's being done out there to support people is really important to me, both personally as a patient association and as an organisation as patient association, because our very ethos and our purpose is around patient partnership in the design and delivery of services, and through that shared decision making in achieving that, in achieving individual consultations to make sure that what matters to people is what we work together on. But also we chair the Digital Coalition, which supports a patient-centred approach to digital transformation. And if anyone wants to drop me an email, I can tell you a lot more about the Digital Coalition. It's got a lot of patient charities and Royal Colleges on there, and NHS Digital App people are wanting to work with you more about this, because what we do want to understand is how to maximise patient and service user engagement and experience through the NHS app. But from a community connectors and a community supporters, we really want to look at how people have been upskilled to use digital services and take that learning to their community, so that we can ensure that those innovations in healthcare are available to everybody. So we'll be running some surveys and focus groups about this piece of work. So today is really instrumental in that. So, you know, thank you NHS England for coming and partnering with us on this. So I just mentioned our previous webinar that we had on giving patients online access. So there's a couple of updates for people who were at that session, and it is recorded and it is on our website. So you'll all know that there's been changes to the GP practice, GP contract, sorry, which were announced in April, and legislation has now been passed so that new health information will be available to all patients unless they've individually opted out or exceptions apply, and that'll happen by the 31st of October at the very latest. But I think the stats are quite important, that nearly 7.5 million patients with online accounts, that's more than one in four, can now automatically view new records entries such as test results, appointment notes and hospital letters online and through the NHS app. So I think, you know, there's something moving forward, but what we have to be really careful is around that inequalities and equalities of access, and make sure that, you know, we make sure that people can access where they want to access their accounts online. So thank you all you community connectors and whatever else you call yourself, for the work that you're doing out there. And please let us know if you'd like to get involved more in the digital coalition that we're working on. So, and today we have Patrick Johnson, who will introduce himself in 1 second, who's going to be doing an NHS app overview. And we've had a couple of questions in that Patrick will be addressing through his presentation. But again, you know, the chat is there for more. And then following on that, we're going to hand over to Paul, who's going to talk a little bit more about online access to GP care.
Excellent. Okay, so yes, good afternoon everyone. My name is Patrick Johnson. My title is Implementation Lead for National Digital Channels. So I work in NHS England, which is part of the Transformation Directorate and Digital Citizen team, which is mainly obviously talking about online applications, and we're talking about the NHS app today. So I'm going to give you an overview of the functionalities within the NHS app. I know we've received a few questions beforehand, so hopefully I will cover those questions. If not, I'll allow a little bit of time at the end to address some of the questions that you might have put in the chat, or that you might want to sort of say at the end of the presentation. I'll give you the opportunity to do that. So I've just advanced to the next slide. Is that okay? Everybody's seen that?
Yeah.
Great. Okay. So the NHS app, and I'm sure most of the callers, most of yourselves on the call today has got the NHS app. And Amanda Pritchard, which is the Chief Executive of NHS England, was talking about the way the NHS app has changed for millions and millions of people who now have the NHS app. And just to show that we are committed in terms of NHS to the use of the NHS app and the development of the NHS app so that it caters for everyone. In terms of the NHS app, there's around 32 million, 32.5 million almost individuals who've registered for the NHS app, and probably about 35 who's actually downloaded the app. So the NHS app has got a lot of users, and hopefully some of those on this webinar today, like myself, are using the NHS app. So what does it look like? The app was launched in, January 2019? It was actually December 2018. And it was me and my team that was a part of that. And I remember we had one patient and we had to walk them through it because I think the then Secretary of State said we wanted to go live. So it's been around not as long as others like Patient Access or Evergreen, but it's been around for over 4 years and we have a lot of users. So the right of that slide shows some of the things that you can have. And what I'm going to go today is go through most of those things that are highlighted. Some of the things I may not cover is like health records. So you're aware that you can access your health record. Part of the health record would also include test results. And I think test results is one of the most useful things that is available to patients. And the good thing about test results, I'll just sort of put this in at the moment, is that when you see a test results, if it's enabled within the clinical system, then your clinician can actually comment on your test results. For instance, Mr. Johnson, the results say abnormal, but in your situation, this is fine, no need to worry. So you can see that, and there's a message on the app that tells you that when you go on your test results, and you as a patient, you don't need to call the doctor to query that. But obviously, it's up to yourself. Some patients still want to make sure that is the case. And you probably realize that there's a limited, you don't have your x-rays. It's mainly around pathology, blood tests, urine tests. Those are sort of results that you will get. We realize at this moment in time that the app is using some of the information and the data that's there on the clinical system. So we're going in stages. At this stage, it's really showing you information there. It's not interpreting that information. It's not presented in a way that is really, really easy to understand. And some patients do say that, but it will show you if it's abnormal, that sort of stuff. Organ donation is there also, so you can choose to opt in to organ donation or opt out, should I say. Lots and lots of thousand people are using it. But let me go into a little bit more detail around some of the things. So I've covered that already in terms of how many people are using it, and that's testimony because we're probably one of those patients who are using it at the moment. So what are the features? Order repeat prescriptions. Now, to me, this is one of the best features of the NHS app. And when I say mainly NHS app, you're probably aware that you use other apps like Patient Access or AMID or different ones, Evergreen, and you can order repeat prescriptions as well. Very, very simple in terms of the slides. It tells you what it look like. You'll see that says prescription. You press on order a prescription, then it checks your pharmacy. I'll talk a little bit more about that later on. And the thing to know that here, it has to be a non-acute, it has to be a repeat prescription. So if you've had a prescription from your secondary care from your hospital, and that's gone to your GP in terms of consultation letter, and it appears to you information, you're not going to be able to order that as a repeat prescription. So it's mainly prescriptions that have been prescribed by your GP surgery. And if you're a regular user of this, you'll know that you'll be able to see the information that you can choose. You tick the box. You then it allows you to also put a caption. So there's a text box that you can say, I don't know what you might want to say, this is now coming for review, this is the last one, etc. And that message will be seen by your GP practice. continue, and then it shows you a summary of what you ordered, and then your prescription has been ordered, so it gives you confirmation. So that's the journey when it comes to ordering a prescription. Just to say, if you've got the NHS app with you in your pocket, in your purse, you can also take it out and have a look at it and follow it through, just to make sure what I'm saying is true. View orders. Now, this is really, really good because once you go into your prescriptions, you can say it says they're view orders. So if you click on that, it takes you to a list of the orders that you have ordered within the app. Now, and also it gives you the status of the orders. So depending on your system, whether it's EMIS Vision or TPP, you're aware that there's 3 clinical systems at the moment. That's what it looks like. My one is TPP. So once my order has gone through, you'll see the status of requested. And then once that tells you that the order has gone from your NHS app into the clinical system, and it's still with the GP practice. Once the GP practice has now sent it to the pharmacy, it will be sent. It will say sent. So the status will change. So you're now aware that the order is with your pharmacy. So there's no need to contact your GP practice, because it's now with the pharmacy, and then you can contact the pharmacy to make sure they've got the order. And if they deliver it, they'll be able to deliver it in the usual timescales, or you can collect it. So really, really useful tool or functionality within the app. And that's just some promotional material that we've just produced over the last month. Your practice should be showing some of those things around order and repeat prescriptions. I mentioned about nominated your pharmacy. So in the journey of repeat prescriptions, it does allow you to change your pharmacy. So I don't know, I'm going to a holiday in Cornwall. I'm in Cornwall. I realize I need a medication. I need to order it, but I live in Luton. I don't want my medication to go to my usual pharmacy. So I go on, oh, there's a Boots next door to my hotel. I get the details, put that in, I change my nominated pharmacy, I order my repeat prescriptions, and it turns up at the boot next door to my hotel. I can get my prescription there. When I go back home, I change it back to my usual pharmacy. Really, really useful tool for you to be able to choose your pharmacy. And it gives you the option every time you order a repeat prescription, this is your pharmacy that it will be going to. If you want to change that, you will be able to change that within the NHS app. One of the newest functionality that we have in the NHS app is messaging services. So traditionally at this moment in time, you will get a message from your GP. You have an appointment coming up. And you might say, cancel. If you want to cancel this appointment, then write cancel back or press this button, etc. And that's an SMS message that comes on your phone. What we've done is that we've integrated the communication suppliers that the GP practices use, and when they send a message, they have the capability to go into the NHS app. So that is really, really good, because you're probably aware that SMS is costly. So each time your practice sends you an SMS, that costs the practice money. Each time the practice sends you an SMS in the NHS app, that's free to use because there's only data. So we're in the process of the last year or so of enabling messages in your app. And if, like me, you go into your app, you probably have a message from COVID in 2020, which was asking about COVID vaccinations or plasma. And that is a similar message. We've updated that now. So for those practices that are being enabled, it does allow you as a patient to see messages within the NHS app. What does it look like? Similar to maybe WhatsApp or the apps that you're aware of at the moment. The practice sends you a message, you get a notification that pops up on your telephone screen. You can see a partial message if you want to read it. Click on it, it takes you into the app. You see the app badge, there's a red dot with a number in it. You click on it and it'll show you the messages from Wilburton Surgery, details of the message. You can either click, and if you want to cancel your appointment, send, and it goes back into the clinical system. Very, very easy. We're all used to that when we have notification and messages on our screen. Linked accounts or proxy access. So proxy access is the ability for a carer and a parent, or a child and a parent to be able to, the parent to see the child's account within, you creating a user ID and password, etc., within their own NHS app. So when you go into the app, you will see the details of the person that you're looking after as a proxy, plus your details, and you can choose. This is very, very useful, you know, if you've got a parent or child or an elderly parent and the daughter or the son who wants to see their account and the details. And that is enabled by your GP practice. What to note is that you do need to be in the same GP practice. If you're not in the same GP practice as the person that you want to be proxy for, then you can use things like patient access, and that app will allow you to have accounts at different surgeries. E-referral, electronic referral. So you go into your GP, they want to refer you to an outpatient appointment at a local hospital. As you know, you can choose which hospital depending on waiting times, etc. Traditionally, you'll get a letter and it'll give you the details, your telephone, the help desk, and then they'll allocate you accordingly. But that information is now available within the NHS app. So your GP can say, I've done your referral, Mr. Johnson. It will that be in your NHS app. When you go home, have a look at it, and you can choose where you want to make your appointment, at what hospital, etc. You don't need a letter to come to you. You don't need to telephone the service desk or the help desk to make the appointment, etc. You can all do it within the NHS app. Advice. Really, really good to be able to get different advice around different medications. Very simple. Is you've got an A to Z, you've got the symptoms. Information is very, very similar. That's now available on nhs.uk. You can now have that in the NHS app. NHS 111 online. We know how useful that service is by telephoning. You can also contact the service online in the NHS app as well. One of the latest functionality that's only been there a few months is register for health research. And I know that some of the questions is that, you know, yourselves as users or patients are concerned about research in this particular area, for instance, MND, motor neuron disease. And this now allows you to, we've integrated with the NIHR, National Institute for Health and Care Research. It allows you to go into their portal via the NHS app. So really, really good service that's there. Appointment bookings and managed vaccinations. So you can now make appointments for COVID as of this year. So for those who had the spring booster campaign for COVID, you could have actually gone into the NHS app, select an appointment, book it, and you can actually get messages that will tell you about your appointment that you've booked for COVID vaccination. Obviously, you can still make appointments if they're available for your GP surgery. But we must say that a majority of surgeries have switched that off, and they have another functionality which I'll cover a bit later on. But if your surgery allows you to make primary care appointments, maybe like, I don't know, blood test or smear or something like that, then can make it available within the NHS app. Okay, so contact your GP surgery in the NHS app. So this functionality allows you as a patient to be able to contact your GP without physically going to your GP or without telephone them, going into the rat race where you're in the queue, you're number 50 in the queue at 8:30 in the morning. How did the other 50 people get into you when it just opened at 8:30? I have no idea. And you're there waiting on the phone for the next 30 minutes only to get the ringtone because they've dropped you off. You've got to start again from 52. This functionality allows you to click on contact your GP, get help with symptoms, additional GP, ask your GP for advice. You go on there and it allows you to be able to contact your GP. You can see very, very simple, gives you type of symptoms, allows you to choose what type of symptoms, where it is, and then you have some previous information, consent information that you would normally tick continue, another confirmation for advice, tick continue, some more things to click again, and again click continue. Yes, you're registered at that practice, getting a little bit more information, your sex. So these are all information, demographic information that the GP will be able to use that goes into the clinical system. It allows you to give a sort of summary of what the condition is. Again, you click continue. So there's quite a few information that you're gathering, or the GP is gathering up front, to make this contact that you do online in the NHS app a lot more meaningful in terms of the symptoms. By the time you actually get whether it's a telephone appointment, because you're doing this in the app, it doesn't necessarily mean that you will actually get an online appointment. It could be a telephone appointment, it could be a face-to-face appointment once you've actually completed this contact information within the NHS app. So I'm going to, for time purposes, I'm not going to continue through it, but you can see it's very, very easy to do. Personal health record. So this is the just one thing I'll go back is that this information, once you start using it, you'll get details from companies like eConsult, AccuRx, Patches, or Engage Health. So these are all companies that have integrated into the NHS app, and they are the ones who are using this, what we call online consultation form within the NHS app. So just be aware, if you see the name of those 4 companies, they're all integrated into the NHS app, providing the contact your GP online consultation. Likewise, we have providers providing personal health record, which is patient knows best in Substract. They're integrated into the app, and you are able to get a lot of detailed information around your secondary care information, care plans, you've got test results, appointments, etc. If your practice has enabled that in the app, you can see that. We also are able to do hospital appointments. So we've got a program rolling out currently to all of the acute hospitals over the next year or so that will allow you to be able to book appointments again for secondary care hospital appointments within the NHS app. I'm quickly going to go through this. So some patients do find this confusing. As you're aware that the NHS app, you've got the automated to prove your identity, and what we call that NHS login, but that it's really, really good because it allows you to self-authenticate without going into your GP practice. And the usual thing it's done, if you've done it, well, most of us have done it before, where you get a little video, you get a face scan, and you upload a document, which is a driving license or a passport. Really, really good because it allows you to get access to your records, all the functionalities I've talked about, and all you're doing is doing this information without you going to your GP practice. It doesn't work for everybody, and if it doesn't work for you, then there's an alternative. You can actually get the information and the details directly emailed to you from your GP practice. We call it a linkage key, but they would send the form to you, and then you'll be able to go and upload the details into NHS login and get access to the NHS app. So we've got some support videos out there if you're not au fait with that. We've also got them in 3 different languages as well, that really, really nice videos. You can find those on on YouTube to help you to be able to understand about using the different IDs to log into the NHS app. And it's available in 4 languages. I won't go through it. So support for information, and a lot of patients, obviously when things go wrong, where do I get the help from? You call your GP practice, they can't help you. There's a help button within the NHS app. You click on that help button and it allows you to be able to go into a contact form, which is an online form. You can only do it online, but you're registered with a ticket number, and it goes straight to our help desk. And we have hundreds of people who are dealing with queries from patients or queries from GP practices with the NHS app. So if you've got a problem, maybe the data isn't correct, or you're having error messages, if you've got error messages there, great. Make note of those messages, click on the help button, go into the online form, and you can complete that. And you can actually put a screenshot there, upload it, you can put details of what the problem is, and they will be able to get back to you. Really, really good and really good support. One of the good things I'm really proud about as NHS App is the accessibility. We've worked with a lot of organizations, whether it's you're short-sighted and you need screen readers, the types of colors that we use, the layout that we do. We work with patients, we do a lot of user research. We make sure that we come through accessibility requirements. And when you get the slides, there's some information, there's a blog there about some of the things that we're doing. And obviously, you know, if there's still, we know that there are issues out there, and I know one of the problems that you highlighted prior to this, which is really, really good, and I will take that back to the team, is the fact that once you've done an online consultation, which is your contact your GP, excuse me, and you have accessibility issues and you're not as quick as, you know, somebody who don't have any impairments, it does take longer, and by the time you click the go button, you've lost the appointment. So that is something that we will look at, you know, to cater for the speed of use of somebody who's got an impairment comparison to the average person who might just go through it with no issues. We're almost at the end, and hopefully you've got some questions that I'll go back to, but I just wanted to cover some of the things that we're doing in 2023 to be able to make the NHS App more improved and to reflect users like yourselves. So what we're doing is that we want to make the navigation of the NHS App a lot more intuitive, a lot more easier to use, whether it's the icon that we use, the layout that we use. We do a lot of user research, we're getting feedback constantly, whether it's in the App Store, etc. We take these things on board, and we're constantly developing the look and feel of the app to make it a lot more easier for yourselves to be able to use. Talked about notifications, so that's something that is very early days. We want to cover a vast majority of 90% of GP practices by 2024 to be able to get notifications for each of those millions of patients who are using those GPs. I talked about booking appointment, flu vaccination for next winter, getting those in the app, getting notifications around that within the app, mental health service, MSK, all those things that are outside also of the NHS, getting those included within the integration of the app. There's things going on around medical record access. I think you've had a webinar about that, making a full record access available prospectively to patients. And we've got the date of October of this year to make it available, I think, to 90% of patients. Test results, we're also looking at test results to make sure that they're available by all GP practices, and it's there that patients can make use of that information as well. Referrals I've talked about, and hospital appointments I've talked about, and we're also looking to enhance the order function so that you have a tracking of your repeat prescription, so you know exactly where it is and when it's ready for you to collect. We've got some supporting information that I will send with you, some of the videos that I showed you. You'll be able to click on the URL when you get these. There's a little interesting table that I created that shows some of the additional apps that's out there, and they compare it to the NHS App in yellow and the different functionalities that are available. So that'd be useful to yourself. And obviously, if you haven't got the NHS App, download the NHS App now, get it in your pocket, start using it, start benefiting from it. We're using it, we work for the NHS, so please do make use of the NHS App. Thank you very much.
Patrick, thank you so much. That was really interesting, and there's some real positive comments in the chat box about how excited people are.
Yeah.
And somebody else asked about is there a roadmap that kind of explains what's on the app?
Yes, so the last slide there is a more detailed roadmap, but the last slide was sort of an easy version of the roadmap in terms of what we're doing.
Brilliant. And then Fran, you've got your hand up there.
Yes, I just wanted to say that, Patrick, thank you for your presentation, which was really extremely useful. I'm a great user of the NHS App, and I'm just going to add, in fact, something to your presentation, which may be of interest to many of the participants. I'm disabled. I have very, very severe hand problems, subluxation. I wear heart splints, and technically, clinically, I'm not allowed to use a smartphone. You've shown, obviously, a smartphone on your presentation. I just wanted to make sure that everyone is aware you can still use the NHS App and a personal health record if you have one if you can't use a smartphone because you can use it with your laptop, the laptop can be used to control the NHS app. And if you have problems using your laptop keyboard, you can use an assistive keyboard. So what I mean to say basically is that patients who are disabled and have impairments can still use the NHS app, which is really a great development, and well done, NHS.
Brilliant. Thanks, Fran. That's helpful for everybody to
Thanks,
know that.
Fran.
Patrick,
Really
there's
good,
another
really good.
There's another question. Do you have to speak to your GP to get access to your health record on the app?
That's a really good question. So when you say health record, it's a minefield out there. So you've got the basic summary information. So so you don't have to speak to your GP, but your GP, if you go through the NHS app, you will by default get the summary information. And that will only give you basic things like allergies and prescriptions, etc. But you won't see the consultations, you won't see any of the documentation, and you won't see maybe test results. Some GPs do have that as default, but it's hit and miss. If you get summary care information and you press a button in the app, it says this information is not available, contact your GP. So you just need to go to your GP and say, I only have summary information. I want a detailed audit record. I want full record access. So full record access is the gold, where you have everything. You've got documentations, you've got free text, you've got notes, and that's the default. But we haven't got there yet. And we're hoping that by October, 90% of patients will have full record access. But it's not going to happen between me and you, but we're going to get there.
We'll get there. We will get there. It'll be the power of patient voice that will get us there.
Yeah, and that's the good thing. And be honest with you, I've been doing this job for 2 years. When I went to my GP, they told me I've got 2 letters that say I can't have access. But I continued, and I have now got full record access. And so I'm telling you, yes, you should, you can get and you should have full record access. Talk to your GP.
Without wanting to take up time, we had a lived experience advisory panel that worked with the Patient Association quite closely, and one of the issues that came up quite a lot of there was around GP letters. It's for another webinar, but it was a gentleman with learning disabilities, and he shared the letter with us about how the letter was written to him. It wasn't written to him. So this is part of the movement to make sure that patients have access to their records. I'm going to take one more question because then we need to hand over to Paul, if that's okay. So Charlotte, do you have another question?
Yes, just quickly for Patrick. With regards to the October date for the records access, is that the complete medical record, or is that only future entries?
This is only future entries. It's not retrospective. This is prospective, so it's future.
Lovely, thank you.
Brilliant. I think I have somebody saying that the roadmap they'd be interested in seeing would be about the developments, Patrick, of what's planned to develop the app onwards, and maybe we can run a couple of these, we can run another one of these in 6 months' time, just to talk more about what's happening here. So Paul, can you introduce yourself, and we'll let you get your presentation up.
Great. Hello. Yes, I'm Paul Wastel. I'm the Communications and Engagement Manager in Primary Care for NHS England. And I've been dealing with, for a couple of years now, a pilot scheme to look at how general practices can enable patients to access care, to request care through their websites, through the process which Patrick described earlier as online consultation forms. So that's what I'm going to tell you about. Next slide, please. So most of you, I suspect, won't have used these forms before, but a bit like Patrick has told you, you can get them through, sometimes you can get them through the NHS app. You can also access these forms through the GP website. So this diagram here is sort of summarizing really what this pilot that I've been involved in is all about. That you can go in via your practice website, find the start button to one of these forms that enables you to request care, fill it out like Patrick has just showed you, but that was via the NHS app. and then you send it off, and sooner or later you'll get a response, and I'll tell you a bit more about that later. But of course, that doesn't mean that you can't phone your practice. You can do that as well, and you can also go to the surgery and visit them and ask for an appointment or whatever it is. So then in this middle stage, the bit that's in the big circle there that says your GP surgery, what's happens then is that the surgery takes the information that has come in through their website, through the form on their website, or actually via the telephone call or via the visit, and they, in some surgeries, it all goes through the same system actually, but whether it does or doesn't, somebody in the practice nowadays is effectively a care navigator who thinks, okay, so this person's telling me they've got a sore toe, and that it's swelled up terribly yesterday. I think that this person fits such and such a protocol, so we'll ask them to come in for an urgent face-to-face appointment with the GP, because it sounds to me as if they've got you know, some serious infection in their toe, and so we'll get them in a face-to-face appointment tomorrow with a bit of luck. Now, the other methods are alternative ways that they might respond to you. They might respond to you by phoning you up, and that's very commonplace, as many of you know, during COVID. Occasionally nowadays, they might give you a video consultation. They might send you a short message by text or email, asking you perhaps a question such as, you know, when did this start, or perhaps asking you to send some photographs or something like that. And then there's these other two methods that they may resolve the thing by. They, you know, occasionally they do a home visit, but very unusual, or occasionally they refer you to another service to provide care. So in the pilot, this little green flag at the bottom, this leaflet, this is the centre spread of a leaflet which is now available in practices across the country, sort of starting to explain a bit more about this, but we've used this model here to explain how GP care works. So next slide, please. So I'm showing you this slide just very quickly because to help all of those of you who may have started to see these materials appearing in your local GP surgery. So on the right there's this pictures of three people, one using her laptop to access the care, one phoning the practice, top right, and one visiting the practice in person. And this is all about inclusive access routes. And the one I'm concentrating on here today is the one on the left, because that's one that nobody knows much about. So I'm going to tell you about that a bit more. And next slide, please. So all practice teams across the country have received these, a series of materials from us, which they're starting to put out on display. On the right here, you see an A3 poster, which you may have seen up on the surgery wall with a bit of luck. And essentially what this slide says is that this isn't just a kind of randomly thought out wheeze of the NHS's. We've researched it quite carefully up in 69 practices up in Humber and North Yorkshire. And we've worked out what works and what doesn't work. And we've published our recommendations and findings on the NHS website if anyone would like to look at it. Next slide, please. And one of the key findings of it was that once this method of contacting your general practice, either through the NHS app in practices that have it, or through the GP website in every other practice in the country, you can use it very successfully to get the service you need. And that if it's explained well to patients how they use this service, then they start to think, oh, you know, I wouldn't mind doing that. It would get me out of that 9 AM or 8 AM phone rush that Patrick referred to earlier. And this might be a really great way of getting hold of my GP or a practice nurse and putting a question to them or an issue to them which they can help me to resolve over the following days. So this slide says, in essence, that, that once the patients up in the northeast of the country had had a look at the materials and had it kind of explained to them, that their confidence levels in using this technique increased massively. They understood what to do, and they, I think it's 63%, isn't it? 64% of them felt confident that their practice would respond well if they use this technique. Next slide, please. So the million-dollar question is, well, how do you find this form to contact your practice on a GP website as opposed to through the NHS app, which Patrick has shown you? And there's a couple of answers here. So the first is that just about every practice in the country, 98% of practices in the country, has a contact form which looks a little bit like the one pictured there in left, where I've ringed in red the contact your GP practice online. And they will have a form like that somewhere on their website, but it's not always easy to find. And we're working very hard with every practice in the country at the moment to try to make them make these forms more prominent on their websites and easier to find. And on the right there, you'll see other names of other services that sometimes these forms are named by. It's not very helpful in our view to have 7 or 8 different names for these services. So the one on the left, I don't know if you can see, it's called eConsult, and that's the most common one of these suppliers in the country. And I think it's probably the one that Patrick showed you earlier. And then on the right, you've got a whole bunch of other suppliers, and you may see buttons that look a bit like those. And those are, you know, very commonly seen on your general practice. And what you need to do when you're doing this is find out, well, which system does my practice use, and where is the start page? So next slide, please. So I've pulled together this next couple of slides, which set out the 8 steps that you need to know, really, the answers to, in order to give you confidence in using these forms on GP practice websites. And so I'm going to run through them very quickly, but you can look at these in your own time because I will provide a PDF slide set after. But yes, there are 4 of them listed on this page, and the first one obviously is being shown by somebody, you know, what is my practice website address, if you don't know what it is, and where on the website will I find the start button for this online form. So the second thing you need to know, and you can find this out, so my suggestion would be that somebody who's going to do this with, you know, a particular group or a particular general practice or a particular group of practices, ideally they would all have the same online consultation system, but that makes it a lot easier then. So the model that I'm working to here is that you would find out from your practice how the system or systems work and how they operate them, and then share that with patients across them. So point number 2 is some practices, but not all, you have to register to use the online forms. Most practices you don't, but some do. And if you do, obviously you'll need how to do that. You'll need to know how to do that. So point number 3 is about the NHS app, which Patrick has just explained, that there are 4 systems which already are integrated with the NHS app, and your general practice might be the user of one of those systems, and they're called eConsult, Engage Health, Patches, P-A-T-C-H-S, and the last one is called, Patrick, help me here. I've lost the name temporarily. I'll come back to that in a minute.
Engage Health.
Engage Health, did I say that? Yeah.
AccuRx.
AccuRx, thank you very much. Yeah, that's the other one. And those are integrated with the NHS app, but it only accounts for about 40% of practices in the country, apparently. So the others aren't integrated. So then in those practices, if you aren't using the app, or in any other practice, if you're not using the app, you can go to the website instead and look for the start button. So point number 4 is, how do I complete the form? Well, each of the forms has its own online prompts, and basically you put in the information that you need to put in. So it's got the word "as" there. It should say "as you like." My quick typo there. I spoke to a GP about this earlier, who's very common user of it, and she said, well, what the information you put in should be like what you would say if you were talking to the GP, and don't worry about grammar or spelling unless you've written the word "as" like I have. The information you provide will provide the practice with information so that when they get back to you, they can make sure the right person contacts you back in a fair, safe and timely way. And once you've completed the form, all you have to do is click send, and that's the job done. Next slide, please. So what happens next? So this is a bit at which many patients' confidence just sort of starts to collapse, as they think, oh God, have I just sent that off into the ether? Has it gone into the blue and I'll hear nothing back? Well, no, the good news is that after sending the form off, you'll receive a reply immediately, automated, which will explain what will happen next with the information and how soon the response will come. And it's different in each practice how soon the response will come, because they have different ways of using these systems. But in essence, it will be, your response will usually come within the working week of the practice, sometime between 8 AM and 6 PM on a Monday to Friday. And in most practices, it's within 2 working days. So you can, depending how your practice uses the system, you can decide and will be advised by the system, as to whether or not you should use this mainly for routine inquiries, or to the extent to which you can ask for more urgent things to be dealt with by them. But in some practices, they really only concentrate on routine things, and they'll tell you that in the website forms. So moving on to number 6. So how does the practice deal with your request? So this is really interesting. So we know that patients' confidence can collapse if they think that, oh, it's just going to be dealt with anybody who's going to, share about it and chat across the surgery about this funny thing they got in on the form. It doesn't work like that, because all the information you provide through the app is confidential. Anyone who reads it is bound by confidentiality. And in fact, the practice will have trained care navigators or trained receptionists or admin team people who will be managing the throughput of these requests. And they themselves will be guided by GPs and nurses who give them clinical guidance about how to respond and the urgency with which the response should come to you. And what kind of response and which professional should speak to you next. So each practice has its own rules around that, but it's all within the kind of clever clinical guidelines of practice governance. So it's all, well managed. So moving on to number 7. So what kind of appointments can you get with the app, with the website forms? And the answer is, well, you can get any kind of appointment that the surgery offers. So whether that's a telephone appointment, a face-to-face appointment, they might send you a text message, they might contact you by video call, any way that the practice gets in contact with its patients in order to provide clinical advice and help is one of the ways that they can contact you. And the second thing to know is that they may also contact you with a growing range of practice health professionals. So it might be their physio, it might be their pharmacist, it might be their social prescriber, their mental health practitioner, as well as a doctor or nurse who might get back to you to resolve your problem or start to resolve it. And that's because practice teams are growing nowadays, and they are teams of people, not just the doctor and nurse who work together on their own. And that means you can get the care you need faster from the right person and closer to home, which is a really great result for patients. And if you need to see your GP, and that's a particular person you want to see, point number 8 covers this. So can I state my preferences? Oh yes, you can. Please do that, and please do tell the surgery on the form that you'd prefer to see a particular person, if you'd prefer to see someone face to face, if you need an interpreter present, and if there's a particular time of day when you need them to ring you, or if you'd like your appointment to be, please put that on the form when you submit it. So that's really all I have to say. Obviously the surgery team will do their best to help you as appropriate, but they have to be guided by clinical guidelines here. And if you say, oh, I've got this really weird condition, but and it's slightly alarming sounding, but you can't contact me throughout the rest of today or tomorrow. In fact, you can only contact me next Monday, which is 3 days hence. Practice is going to ignore that request and get hold of you pretty quick, because they can see that you need urgent attention. So that's the 8 steps really to make it easier to give patients confidence in using online forms on a GP website. And hopefully that'll be very useful for you all. So any questions? Next slide. That's my question slide.
Brilliant. Thank you, Paul. That was really, really helpful. And I think, you know, a lot for me, what I'm hearing here is around how we always give patients the power to take control that they may want to take about their access and their healthcare. Does anyone have any questions that they want to ask? Suzanne?
Sean.
Hi, yes. Oh, sorry, Sean, go on. You go first.
I've got a question about, I live in Leicestershire, right? And obviously, if I go to the hospital or the doctor or whatever, they've got access to my records. But if you go to another primary care services like Nottingham or something, because recently what happened was I had to go there and have my blood tests and etc. in Nottingham. And I said, oh, you'll have access to my records to have a look at when I had my last blood test. And he said, no, we don't. I said, why is that then? So I just wonder whether there's any way that they're going to be working in future as to where they'll have access to other primary care, like cities or, you know.
Really good question, Sharon. Thank you for that. Paul, Patrick, is that a quick one that you can answer? Because we need to answer it, but.
Yeah, it's not one I can answer, I'm afraid. My knowledge is confined to the forms on the GP websites, really, I'm afraid.
Yeah,
Patrick might know a bit more.
What they should have is your summary care record, SCR. So paramedics, different organisations across England should have access to summary care record. It is a summary, so you've got your allergies and, you know, you won't have any detailed consultation, especially with secondary care, because each secondary care EPR system is electronic patient record is different and they don't talk to each other. But the summary care record is available to everyone in the NHS, so it gives them basic information.
That's what I thought. But very quickly, and Suzanne, come and get the last question for you because we have 2 minutes. But Patrick, in time, if everything's on the NHS app, there'd be nothing stopping Shan showing the consultant the NHS app. Because I know that Fran and somebody else who did the access to medical records, they said they do. They'll show the app.
The only thing with the NHS app is for the patient. So it would be up to the patient to show.
Well, but that's what I mean. The patient could make a choice to say, well,
yeah, exactly. Yeah, exactly.
Yeah, brilliant. So Suzanne, your question.
Yeah, sure. So I work with the Patient Association. Hello, I have troubles getting in. Apologies for being late. It's really, Paul, about that flow that you had on the first chart about the different access routes. One of the pieces of feedback I get from a lot of people that we engage with is they're confused about the fact that, you know, they may want a face-to-face appointment, but they keep being offered a telephone appointment. And many surgeries offer that as a kind of triage in a way. You know, the GP, one of the healthcare professionals, will speak to them and decide whether they need to see them face to face. And a lot of people don't quite understand that, and so they get frustrated, annoyed, because they think all I can get is a phone appointment. But actually, that's not all they can get. It's just another step on the way. And I wondered whether you'd had that feedback and whether that was something that maybe needed explaining when you're next revising your materials.
Yeah, I mean, it's absolutely something I understand. It's throughout COVID, practices have started working differently, and they've started using telephone appointments more commonly than they used to do, and that's gradually shifted back the balance so that practices are using face-to-face more nowadays. But I think you're right that there are different practices who operate things differently, and that there are more practices who are using phone consultations initially than there used to be. And that's partly because, as you say, sometimes they can use those as a triaging device to find out more about the patient. You know, perhaps they didn't put a very complete request information on the form, or however they, you know, whatever it was, in whatever form the contact request came in. So a phone call is often the quickest way that they can get additional information in. But absolutely, you know, if the clinician thinks that the patient needs to be seen face to face, and indeed if the patient prefers to be seen face to face and needs to be, then that can be arranged.
So it's just that some people feel they're being fobbed off when they're not. Actually, it's part of the process, and that they will get a lot of attention. So it just might need a bit of explaining.
So I think maybe what you're asking for there is a type of roadmap as well, to say here are the options, and Paul, that you could work with that on the, you know, your 8 pieces of advice for patients that you did there. But so we've come to the end of this session. Thank you so much for everyone who attended. I hope you found it really beneficial. I did. I learned a lot this evening. So Paul and Patrick, thank you so much. I think we'll have a conversation again about maybe how we could do a bit more on this piece of work to make sure the patients really feel the power. You get a couple of virtual claps there, so that's brilliant. So thank you all for joining, and I hope you all have a fabulous evening.